Well, there's so much that I want to talk about, but I do want to stay focused because my videos is basically for survivors. There's so much going on. Of course, more shootings that's going on that we probably don't even hear about, the government being shut down. I don't even want to get into politics. There is still so much that's happening here in Las Vegas in regards to Las Vegas massive shooting. I wanted to do an update just to let you know that I have had my second surgery, so I'm in the process of recovering. If I knew, I guess, what I know now, I probably would have waited for the second surgery to be after the first of the year. In my mind, I wanted to have the surgery because I did not want to carry this over into 2019. I just wanted to get it out of the way. I felt like that was a healing process for me, but not fully understanding the difficulties that I was going to have to go through with dealing with my left shoulder, the rotator cuff. I guess I'm about 45 or 50%. So, mm, yeah, I'm going to say I'm about 50% there. I still can't do it like so. Now, if I lift it with my golf club and use my other hand to push my arm up, I'm able to do that. But by itself, I can go up to about right here. So I'm still in therapy. Let's talk about that part. Um, 3 times a week. Once I had surgery, this kicked out the second surgery. So what I'm basically saying without saying is I had to wait almost a month or a little bit over a month to get back in therapy. I know I am not the only one who has had 2 surgeries. So I don't know where the paperwork is. Everybody wants to blame everybody. Nobody wants to take fault, assume responsibility for the casino. It didn't matter who fault it was. In the hospitality industry, you try to figure out how you can resolve the problem. Okay, I'm sorry this happened to you, but what can I do for you within my power? What can I do for you? And then not only that, listen to the person. So I'm going to get to that part in just a moment. So I had to call the people and get back into therapy. Now it's time for me to the doctor. I'm being very selective and careful of what I say for certain reasons. No name dropping. I'm not gonna call nobody out. But at the end of the day, I'm waiting for my surgeon to authorize me to go to therapy. Now I'm in a boot, I'm on a scooter, so I have authorization to go to therapy. Now, how does one get to therapy when you have a boot on? You're on medication, on ice 4 to 5 times a day. Oh my God, that means I must have transportation. This is when your doctor don't listen to you because the first question they should say is, how many people in your household? That might be a great question before they think about what is it that you need so that they can be a great provider to you and get you the assistance that you need. So we're not even going to talk about that. So let's go back to now we need transportation on the ankle while I'm in therapy on the shoulder. So stay with me. It's only 5 days in a week. So at this time, I'm going to go, as of today, I'm arranging to go to therapy 5 times. So that means there is no life. So if you know anything about therapy, well, you went to therapy. So usually I take a pain pill. I'm telling you the truth. I'm not off no pain medication. I'm not trying to wing myself off no pain medication. I'm trying to be as comfortable as possible for me. You do what you have to do for you, and I'm going to do what I need to do for me. So I take a pain pill while I'm on my way. Remember, I'm not driving, transportation has been arranged. So I take my pain pill while I'm in the car, then I can do my exercises, blah, blah, blah. But about time it's time for me to try to practice to walk on the walker. I pray to God the pain pill has kicked in. Let me tell you something. Today, I didn't do anything but cry, cry, cry. I can't even move my toes. So, these are my toes. Just picture my hand being my toes, and there's a tile. So, I'm trying to grab the tile with my feet. Can't move it. I'm trying to flex my foot. Definitely couldn't go to the side. And then you're talking about bear all your weight on one foot. It's just not happening at this time. And ironically, I'm still waiting on a walker. I had a prescription dated December the 20th, another prescription dated January the 2nd for the same walker. I do not have a walker. I mean, who is helping survivors? Not to say that we should be over someone else being injured. I'm just saying, do we have an advocate for survivors of Route 91? Do people just even damn care? Or we just another person, paperwork sitting on the desk. When we get to your desk, when I get to your stack of papers that's on my desk, I'll take care of your situation. So in the meantime, I am going to therapy 3 times, still dealing with my shoulder, and now it has been arranged, approved, whatever, for me to start having treatment on my ankle. So today was my second day. So I'm almost 7 weeks in. The surgery was right after Thanksgiving. So I'm 7 weeks in, and I'm just now starting to have therapy on my ankle, and I have no walker. If though this is the first time the surgery has been done, when you have the surgery, I knew I was going to have the surgery. They knew I was going to have the surgery. The scooter was delivered. Now I go back to follow up, and they say, we need to start getting you on the walker. I'm like, well, that's nice. Well, where is the walker? Is it going to be delivered? And then you hand me a prescription. Why do you hand me a prescription if I can't drive? I, sometimes I'm just like, Jesus, is it me? So is it somewhere that I call? How do they get the prescription? I mean, I can't turn in the prescription because they're going to be like, who are you? The prescription needs to come from a doctor. I just say to myself, I'm not crazy, but just pay attention to what's going on. You're not being represented. And you need to know when you're not being represented fairly, properly, and you need to say something about it. If you're not happy with your doctor, you need to say something about it. You're not happy with your therapist, you need to say something about it. I'm telling you, you are your best advocate because don't nobody give a damn about your welfare and your beings but yourself. I have had tough week. Let me tell you, just about every day since Monday, I have been crying because it's been something that I have had to deal with that I personally felt like it should have been already handled. So you have to make sure this is intact because people will run over you and do what they want to do. And you have to say, hold it, hold it, hold it, hold it, hold it. I have not lost it. We just talked about this. You have not noted this in my file. Why isn't this in my file? I fell on the scooter. That's not noted in my file. I had to check the doctor and say, I know that I'm black, but if you look at my foot, that's green and that's purple. That's a bruise. You need to notate that in my chart. One survivor to another survivor, you have to fight. I'm tired. I'm tired. I'm tired. And I know you are tired. We are tired, but we matter. And I make these videos just to let you know you're not the only one and you're not tripping. You are not tripping. People do not care about your welfare. You have to care for yourself. You have to love yourself. You have to keep your mind in check. Write down all your notes. And I know sometimes it just seems so tedious. But when you get them on the phone, you say, who am I speaking to? If we get disconnected, can I get a callback number? Because you may have to talk to the same person 2 or 3 times and you may have to remind them. You just spoke to me 3 days ago and you said you were going to handle this. So where are we now? Because it's still not handled. I have been wanting to do this video for the last 4 days. But like I said, I have been so upset. I'm still waiting on a walker. And I'm just letting you know this because maybe you're still waiting on some equipment that's needed for you to do your exercises, if you will. Or as they say, this mobility thing is what you're needed to help you have stability and you don't have it. So then they turn around and put it on you as in, why aren't you walking? Or why aren't you lifting your arm? Maybe supposed to have to help you. I don't. But then they want to talk to you like you're crazy. When they do that shit, you check they asses. Do you hear me? Check they asses. Because you are the patient. Don't forget that. You are the one that is seeking help. They don't have the right to talk to you any kind of way. You just want them to do your job. You're not asking for no favors. Just do what you are supposed to do so that I can get well, I can heal, and get yourself back to work. Because post traumatic stress disorder, you're going to have that for a while. And if they tell you, oh, 6 months, a year, they lying to you. Everybody is going to recover on their own time. And again, it depends on what you've seen. Where were you when it happened? Were you outside the gate, inside the gate, on the field, at the barbecue stand, at the lemonade stand, on one of the rides? Where were you? Luxor, at the Tropicana? I'm just saying. I'm just saying. Where were you? So wherever you were is how you're going to be affected. Today is like pouring down raining, and I try to only take my pain pills, at night. But by 10 o'clock this morning, I was reaching for Tylenol number 3. I'm talking about just crazy. By 12 o'clock, I've already had 2 Tylenol number 3 because my left shoulder was kicking my butt. Then I wanted to rest up, have a little lunch, and be prepared for therapy. And cried for at least an hour. So I just want to encourage you. And I just want you to know that my days are not all good. So don't feel like you're by yourself. And I probably have more bad days than I have good days, but I try to keep smiling. It's a fake smile, but nobody knows. Just keep smiling. Somebody say, how you doing? Just say great. Just great. Just great. Just great to be alive. Just great to be above dirt. Because nobody want to hear your story. What are we? 13, 14 months after the shooting? We still don't know what happened. That's going to always bother us. We will probably never, ever, ever find out the truth. Because they always say what happens in Vegas, stay in Vegas, but this need not to stay in Vegas. Keep talking about it, talking about it, keep sharing. Here we I hate that. Every time I get ready to record, the phone get ready to ring. And if for some reason I don't know how to block the doggone call from coming in, so it's interrupting me as I'm talking. But today, this is for you as a survivor. I just need you to hold on. Please hold on. Don't give up. There's other people that's out there that's fighting for us because we can't do it all. We cannot do it all. Just continue to breathe when you getting triggered. Just try to breathe. Think of something positive. For me, it's water. I think about the ocean. I would love to be at the beach right about now, but hell, I can't even walk. But think about something positive. Think about something that made you happy. So when you get triggered, go to that happy place. Continue to pray for me. I'm going to continue to pray for you. I just wanted to give you a quick update on how I was doing. And as of today, I'm still not walking, um, still not driving, and I will just keep you posted. So, for those of you that are out there and you're fighting for us, continue to fight. If there's any tag my page. The only person that I know about is victims of crime, and that's very limited. Then you had Route 91 Strong, Lisa Fine. That is a one time assistant, and I'm very grateful. They helped me back in April. I'm extremely grateful. But again, I'm still not working. That's a one time thing. It'd be great if we had 12 foundations and you had 12 people that can help you at least a year to help you get yourself back up on your feet. But guess what? That's not what's happening. And I played the lotto. If I hit the lotto, I will open up a foundation myself so that I can help you because I know what you're going through, because I know what I'm going through. And you can't just keep calling people all the time. Can you give me a ride? Can you give me a ride? Can you take me to the pharmacy to get my medication? Can you take me to the grocery store? Can you help me wash clothes? I can't even walk up my steps. So, one survivor to another survivor, never give up. Keep fighting. And I'm not even going to tell you to stay strong because I know you're sick of people telling you to stay strong and just hold on. I'm going to tell you to just think of something positive and relax your mind. And tomorrow is going to be a better day. Hang in there. God bless you. And I truly love you. Thumbs up. Continue to subscribe. And I hope you're listening, you're tuning in, and you're learning something. Each video, I try to give you a message. And the message today is don't give up on yourself. You do not have to accept what people are telling you. If you're not happy with your psychiatrist, get another psychiatrist. You're not happy with your doctor, get another doctor. I have been through 5 psychiatrists and on my way to number 6. And if I have to go through 10 different ones, I'm going to get one that's going to listen to me because I'm the patient. Thumbs up and subscribe. God bless you. Thank you for tuning in.